Hello, my name is Alhamdah, and today I'm going to be talking to you about our longitudinal study examining depression in older surgical patients. Depression affects individuals across various ages and populations, including older adults. But what about surgical patients? Depression is of particular significance in the older surgical population due to its adverse impact on cognitive function, surgical recovery, and overall quality of life. Our study aimed to examine depression in this vulnerable population. We consented participants 65 years or older undergoing elective non-cardiac surgery from 2 pre-op clinics at hospitals in Canada. To assess for depression, participants completed the 15-item geriatric depression scale through an online survey at 4 time points. We use a cutoff of 5 to define depression. 307 participants completed their preoperative assessment, of which 20% screened positive for depression. 8 participants were already diagnosed with depression according to their medical chart, meaning that about 18% of our participants had unrecognized depression. The prevalence of overall depression, shown in blue, decreased over time to 18.7% at 180 days post-op. This decrease shows that as time progresses after surgery, older patients show adaptability in coping with post-op recovery. However, the high prevalence still shows the enduring nature of depression, and so pre-op identification may serve as an early detection moment to prevent persistent depression after surgery. We also evaluated pre-op factors associated with pre-op depression and found that cognitive impairment and sleep disturbances each had about 3-fold higher odds of pre-op depression. Those with pre-op functional disability had about 4-fold higher odds for pre-op depression. Finally, we assessed for various clinical outcomes and found that participants with pre-op depression had about 2.5-fold higher odds of discharge to non-home destinations, most likely owing to their worse functional ability, which requires additional physical and social support for improved recovery. All in all, our findings support the high prevalence of pre-op depression in older surgical patients and highlight the various factors associated that should be optimized for better care. I would like to acknowledge my team for all their help and support, and thank you for your attention.